The HeartStart FRx is a small, rugged, lightweight device used to treat ventricular fibrillation, the most common cause of sudden cardiac arrest. Sudden cardiac arrest is a leading cause of death in the United States and many countries throughout the world. At present, fewer than 5% of sudden cardiac arrest victims survive. Many more could survive if treated promptly by a defibrillator. Although defibrillation won't save every victim, defibrillation is the only effective treatment for sudden cardiac arrest due to ventricular fibrillation. Unfortunately, many times emergency medical services cannot reach the victim in time. For every minute without CPR and defibrillation, chances of survival decrease 7 to 10%. Beyond 10 minutes, survival is very unlikely. Obviously, time is of the essence. Early defibrillation greatly increases a sudden cardiac arrest victim's chance for survival. The Philips HeartStart FRx defibrillator makes it possible for a range of rescuers to respond to sudden cardiac arrest. It is an easy-to-use, rugged defibrillator designed specifically for those who get there first. It is simple to learn. It provides clear, calm voice instructions to guide you through each step of its use.
Remove clothes from patient's chest.
And it can help you save the life of someone in sudden cardiac arrest.
Shock delivered.
This video provides the basic information you need to set up, operate, and maintain the HeartStart FRx defibrillator. The FRx is intended for use under the oversight of a physician as part of a well-designed emergency response plan. Anyone who might use the FRx should also have training in cardiopulmonary resuscitation, CPR, and defibrillator use. First, let's take a quick look at the layout of the HeartStart FRx defibrillator before setting it up for use. In the upper right corner is a small green LED. This is the ready light. When the battery and pads are installed, the ready light blinks to show that the FRx is ready for use. Below the ready light is a green on-off button. Once the FRx is set up, pressing this button turns on the defibrillator and begins the voice instructions. The on-off button is also used to turn off the FRx at any time by holding it down for 1 second. Near the center of the panel is a blue button with an eye on it. This is the information button, or I button. If you press the I button while it is flashing, the FRx gives you information, such as optional CPR coaching, device status, or troubleshooting help. Below the I button is the caution light. It has a symbol of a hand with a line across it to represent "Do not touch the patient." The caution light automatically comes on when the FRx is analyzing the heart rhythm or delivering a shock, as a reminder that no one should touch the patient at these times. In the lower right-hand corner is the shock button. It is orange with a lightning bolt symbol. If a shock is needed, the shock button will start flashing and the HeartStart FRx will instruct you to press the button to deliver the shock. In the center of the front panel is an illustration of correct pads placement on an adult or a child over 55 pounds or 8 years old. As you will see, the pads icons on the illustration flash when the FRx is turned on for use as a guide to correct pads placement. Finally, here is the pads connector port. And here is the infant-child key slot. We'll discuss those in a moment. The HeartStart FRx is designed to be stored in a standard carry case or in a hard-shell carry case where conditions require it. Both cases are available from Philips separately. Setting up the FRx is simple. Each FRx comes with a 4-year battery, HeartStart Smart Pads 2, Owner's Manual, and Quick Reference Guide. Take time to read through the Owner's Manual to familiarize yourself with the FRx. The Quick Reference Guide is designed to be kept with the FRx. It provides illustrated instructions for use in an emergency. The FRx uses specially designed HeartStart Smart Pads 2, which allow the defibrillator to be stored with the pads set pre-connected. Open the pads package and remove the pads case. Do not open the case until the pads are needed for use in an emergency. Each gray pads case contains 2 adhesive pads. The pads cable extends from the case and ends in a connector plug. Plug the connector plug into the defibrillator, snapping it firmly into place. With the optional infant-child key, the same pads used to treat adults are used to treat infants and children. The battery compartment is located on the back of the FRx. Remove the battery from its bag. Place the bottom of the battery into the compartment, then snap the top firmly into place. If you have a spare battery, keep it in its unopened bag. As soon as the battery is installed, the FRx will run a battery insertion test.
Beginning self-test. If this is an emergency, press the green on-off button.
Be sure to let the test run and follow the voice instructions for pressing buttons when directed. The test takes just over a minute to complete. When the test is over, the FRx will report the results, then turn off and go into standby mode. The blinking green ready light shows the defibrillator is ready for use. The FRx standard carry case opens with a quick tug on the Velcro closure. The FRx fits snugly into the right side of the case. The other side has a lower compartment for storing a spare battery and spare set of pads. Leave these in their unopened packaging until needed. The upper compartment holds the pre-connected pads case and the quick reference guide. There is also a sleeve to hold the optional infant-child key. When the case is closed, the blinking ready light can be seen through the case. Always store the FRx with a set of Smart Pads 2 connected and a battery installed so it will be ready to use and can perform its daily self-tests. Now, let's run through the sequence for using the HeartStart FRx defibrillator.
Hey Bill, are we going to have enough books to fill this order today?
We're going to be fine.
Okay, it's really important this order go out by noon today, all right?
Don't worry, I'm on it.
Okay, great, thanks. Hey Greg, how's this new conveyor system working out for you?
Dan, I think we got it just right. The computer's going to control the program. So that... Hey, Bill! Bill, are you all right? He's not responding. Call 911 and get the defibrillator.
Okay. Yes, hi, I'm at Silverman Industries. I've got an employee who's collapsed on the floor. The address is 990 Owens Loop. He's unconscious, not responsive on the floor. I don't know if he's breathing or not. Yes, we have an AED. Go get it. No, the phone is not portable. Okay. Okay. Here's the defibrillator.
Hey, thanks.
I'm gonna go out and wait for EMS.
All right.
Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
Hi, what do we have here?
Well, Bill passed out and dropped to the floor and...
Okay, I see you got the defibrillator set up here. Did you have to deliver any shocks?
Yeah, we did.
Yes, you did. How many did you deliver?
Well, push and hold that blue button there and tell you how many.
1 shock, 4 minutes.
Okay, let's go ahead and get some vital signs set up. And I'm gonna go ahead and plug this machine in. Mine.
We got some help, Bill.
Before using the FRx, confirm that the patient is in cardiac arrest by establishing that the patient is unresponsive and is not breathing normally. Assess responsiveness. If the patient is unresponsive, immediately call 911 or the emergency medical services number for your area. If another person is available, ask him or her to make the call and bring the defibrillator. Open the airway and check for breathing. If the patient is not breathing normally, give 2 rescue breaths. Usually, a person in sudden cardiac arrest is not breathing at all, but sometimes abnormal, ragged breaths occur for a short time after collapse. If the FRx is not immediately available, perform CPR until someone can bring it to you. Once the FRx arrives, quickly apply it to the patient. Using the FRx is very easy. Place the FRx carry case on the same side of the patient that you are on, near the patient's head. Open the case. Press the green on-off button to turn on the defibrillator. The FRx will start giving you clear, calm instructions for using it.
Remove clothes from patient's chest.
As instructed by the FRx, remove the clothing from the patient's chest. Tear or cut it off if necessary.
When patient's chest is bare, open gray plastic case and peel off white adhesive pads.
Then remove the gray plastic pads case and open it.
Attach pads to bare skin exactly as shown.
Next, place the pads.
Look carefully at the pictures on the white adhesive pads. Peel 1 white pad from the gray case.
Peel 1 adhesive pad from the plastic case and place it on the patient's bare chest, following the illustration on the pad.
Place pad exactly as shown.
It does not matter which pad is placed first. The FRx times its instructions to match your pace. It will remind you to place each pad on the patient as shown in the illustration.
When the first pad is in place, peel the second pad. Place pad exactly as shown.
Then peel the second pad from the plastic case and place it.
Press pads firmly to patient's bare skin.
As soon as the pads are attached, the HeartStart FRx automatically begins analyzing the patient's heart rhythm.
Stay clear of patient. Analyzing heart rhythm.
Rescuers should not touch the patient while the defibrillator is analyzing. The caution light will turn on and start flashing as a reminder that no one should be touching the patient. If a shock is advised, the caution light will stop flashing and remain on, and the orange shock button will start flashing.
Shock advised. Stay clear of patient. Press the flashing orange button now.
Before pressing the button to deliver the shock, you must make certain that no one is touching the patient. Press the orange shock button to deliver the shock. For safety reasons, the shock will not be delivered until you press the button. After delivering the shock, the FRx immediately tells you to begin CPR and provides a CPR interval. During the first 30 seconds of the interval, you can press the flashing blue I button and the FRx will provide CPR coaching.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
Provide CPR until the patient begins breathing or moving, or the FRx tells you to stop CPR or to stay clear of the patient. Leave the pads attached to the patient and the FRx turned on in case additional shocks are needed. In all cases, continue to follow the defibrillator's instructions until the emergency team arrives. When the EMS team arrives, let them know that the HeartStart can tell them how many shocks it delivered and how long it has been since it was turned on by pressing and holding the blue I button until it beeps.
1 shock, 4 minutes.
This information will be helpful to emergency medical services personnel as they continue to provide care to the patient. The EMS team may also wish to attach the FRx's pads to their own defibrillator. The SmartPads 2 can be connected to other defibrillators that have a HeartStart compatible connector plug or adapter.
Infant child mode.
Go into the art room, okay, boys?
Okay. Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the infant child key. Peel one white pad from the gray case. Place pad in center of child's chest. When the first pad is in place, peel the second pad. Place pad on child's back. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm.
The HeartStart FRx defibrillator can deliver defibrillation shocks to infants and young children under 55 pounds or 8 years old using the HeartStart SmartPads 2 and the infant child key. The infant child key is easily identified by the pink ring and infant child icons. If you need to use the FRx defibrillator on an infant or child under 55 pounds or 8 years old, and you have an infant child key available, remove the infant child key from the carry case. Insert the key into the slot near the top of the defibrillator. Be sure to press the key down until it clicks into place. Then turn on the FRx if you haven't already done so.
Infant-child mode.
It does not matter whether you insert the infant-child key before or immediately after turning on the FRx. However, the key should be inserted before placing the pads on the patient. Because of the small chest area of these young patients, the HeartStart Smart Pads 2 are placed differently on infants and children. Icons showing the proper placement are on the key and light up when you turn on the FRx. After removing all clothing from the child's torso, place one pad on the bare chest between the nipples, exactly as illustrated on the infant-child key. Roll the patient onto his side and place the second pad on the back, between the shoulder blades. The HeartStart FRx defibrillator immediately begins analyzing the heart rhythm and, if needed, will deliver a shock at a lower energy, appropriate for infants and young children. If you need to use the FRx defibrillator on an infant or child under 55 pounds or 8 years old, but you do not have an infant-child key, do not delay treatment. Go ahead and use the Smart Pads 2 without the key, but still place the pads on the child's chest and back. However, if you think the child may be over 55 pounds or 8 years old, do not spend time trying to determine the exact weight or age. Use the FRx without the key. Because infants and children often become unresponsive due to breathing or other issues which may lead to cardiac arrest, all persons trained to use the FRx defibrillator on pediatric patients should also be trained to provide pediatric CPR and other basic life support. The FRx can provide optional CPR coaching designed to assist rescuers who have had previous training in CPR. When the FRx provides a CPR interval, the blue I button will start flashing and continue for 30 seconds. If you press the I button during this time, the FRx will provide voice instructions to coach you in basic CPR and provide a rhythm for compressions.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
CPR coaching talks you through 5 cycles of CPR, beginning and ending with compressions. If the infant-child key is inserted, the device will provide coaching for applying CPR to infants and children. At the end of the interval, the FRx reanalyzes the heart rhythm. Do not touch the patient during rhythm analysis. If no shock is advised after rhythm analysis, the FRx will instruct you to begin CPR if needed. Provide CPR unless the patient is breathing or moving. After each 2-minute CPR interval, the FRx reanalyzes the heart rhythm. Continue to follow the defibrillator's instructions until the emergency team arrives. To summarize, after confirming that the patient appears to be in cardiac arrest, push the green on-off button to turn on the FRx.
Remove clothes from patient's chest.
Follow the voice instructions. Access the pads in their gray pads case. Remove one pad from the pads case and apply it exactly as illustrated on the pad.
Attach pads to bare skin exactly as shown.
Then repeat with the second pad.
Press pads firmly to patient's bare skin.
Do not touch the patient while the defibrillator analyzes the heart rhythm. If a shock is advised, clear the patient and press the shock button.
Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered.
Continue to follow the voice instructions until the patient can be delivered to the next level of care or as your protocols indicate. Data management is simple with the HeartStart FRx defibrillator. It automatically stores in internal memory detailed data from its last use, including the first 15 minutes of ECG. As long as the battery is not removed, ECG data will be retained in the defibrillator's internal memory for 30 days. Additional data is stored for up to 7 years. Using one of the HeartStart Event Review data management software products, you can store and review the recorded information. The stored data can be conveniently downloaded in the field to a handheld PDA for later transfer to a computer, or transferred directly via infrared communication to a personal computer. Instructions for transferring the data are provided with the HeartStart Event Review software. Event Review software, installed on a PC or a PDA, also allows your program administrator to change the default configuration of the FRx under the guidance of medical direction. The FRx is highly configurable to meet the needs of local protocols. Detailed information about configuration is available in the FRx Owner's Manual and in the Event Review instructions for use. If the FRx detects a problem while you are using it, it will provide a voice instruction to guide you in correcting the problem. If this happens, stay calm and follow the defibrillator's instructions.
Press pads firmly to patient's bare skin.
For example, good pads contact is key. The FRx tells you if the pads are not making good contact and directs you to press the adhesive pads firmly onto the patient's bare skin.
Press pads firmly to patient's bare skin.
If the instruction continues, remove the pads from the patient. Dry the skin where the pads will be placed if it is wet. To use a new set of pads, first remove the Use Pads connector from the FRx. Take the new set of pads from their package, plug in the connector, and apply the pads. In cases where excessive chest hair is preventing good contact between the pads and the skin, remove the pads and quickly shave or clip the chest hair. Refer to the owner's manual provided with the FRx for additional detailed troubleshooting information. With its long-life battery, Ready Light, and automatic self-testing, which also checks the pre-connected SmartPads 2, the HeartStart FRx defibrillator is virtually maintenance-free. It is designed to be tough and reliable in a range of environments. It can be stored and operated in temperatures between 32 and 122 degrees Fahrenheit, 0 to 50 Celsius. The FRx has no user-serviceable parts and should be returned to Philips in the event that service is needed. As long as the Ready Light is blinking and the FRx is not chirping, you can be confident the defibrillator has passed its most recent self-test and is therefore ready to use. If the Ready Light is not blinking and the FRx is chirping, it needs attention. Open the case. The blue I button will be flashing. Press the I button for more information and follow the defibrillator's instructions.
Replace battery immediately.
The FRx Owner's Manual contains additional information on maintaining and cleaning the FRx. Periodically, and after each use of the HeartStart FRx defibrillator, you should also check that all supplies and recommended spares are undamaged and unexpired. The HeartStart FRx defibrillator is an easy-to-use, rugged defibrillator designed for those who get there first. Turn the device on and follow the instructions as it guides you through each step in treating a victim of sudden cardiac arrest. The FRx alerts you to any problems it detects and guides you in correcting them. Philips recommends that you train on the device you are likely to use. However, you should also be familiar with the other HeartStart defibrillator models if for any reason you need to use one in a rescue. The HeartStart On-Site uses a pre-installed PADS cartridge. You can turn on the on-site either by pulling the green handle on the PADS cartridge or pressing the on-off button. Pull the green handle, remove the hard cover from the PADS cartridge and set it aside. Peel off the film seal and pull the yellow tab to remove the pads from the cartridge. Remove one pad from the yellow liner and apply it exactly as illustrated on the pad. Then repeat with the second pad. Do not touch the patient while the defibrillator analyzes the heart rhythm. If a shock is advised, clear the patient and press the shock button. After delivering the shock, the on-site immediately tells you to begin CPR and pauses to provide a 2-minute CPR interval. The blue I button on the front of the defibrillator will be flashing for the first 30 seconds of the CPR interval. If you press the I button during this time, the on-site will provide voice instructions to coach you in basic CPR and provide a rhythm for compressions.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Breathe. Breathe.
CPR coaching talks you through 5 cycles of CPR, beginning and ending with compressions. At the end of the interval, the on-site reanalyzes the heart rhythm. Do not touch the patient during rhythm analysis. If no shock is advised after rhythm analysis, the on-site will instruct you to begin CPR if needed. Provide CPR unless the patient is breathing or moving. After each 2-minute CPR interval, the on-site reanalyzes the heart rhythm. Continue to follow the defibrillator's instructions until the emergency team arrives. The on-site can be used to provide reduced energy defibrillation of infants or children under 8 years of age or 55 pounds. The on-site uses an infant-child PADS cartridge. If the infant-child PADS cartridge is available and not already installed, remove the adult PADS cartridge from the on-site by sliding the latch at the top and lifting out the cartridge. Remove the infant-child cartridge from its packaging and install it in the defibrillator. Be sure to press the cartridge down until it latches into place. Then pull the green handle to begin the rescue. PADS placement is illustrated on the back of each pad. The HeartStart FR2 Plus features a text screen for display of messages and, for the model M3860A, the patient's ECG. The FR2 Plus pads are not pre-connected. To use the FR2 Plus, confirm that the patient is unresponsive and not breathing normally. Turn on the HeartStart FR2 Plus by pressing the green on-off button. Then apply the defibrillator pads and plug in the pads connector. Do not touch the patient while the FR2 Plus analyzes the heart rhythm. If a shock is advised, clear the patient and press the shock button. After delivering a shock, or if no shock is advised, the FR2 Plus will provide a CPR interval
Paused. Begin CPR.
followed by reanalysis of the patient's heart rhythm. Continue to follow the prompts from the HeartStart FR2 Plus until the patient can be delivered to the next level of care or as your protocols indicate. The HeartStart FR2 Plus uses special FR2 infant-child defibrillator pads to treat patients under 8 years of age or 55 pounds. Equipped with a pink teddy bear-shaped connector, these pads reduce the energy delivered by the defibrillator to a level more appropriate for infants and children. To use the infant-child pads, turn on the FR2 Plus, remove all clothing from the child's torso, and open the pads package. Place one pad on the patient's bare chest between the nipples and the other on the patient's back between the shoulder blades. Insert the pink connector into the connector socket on the FR2 Plus next to the flashing light. Using the FR2 infant-child pads does not change the voice and screen prompts of the FR2 Plus defibrillator. All HeartStart defibrillators are designed to be easy to use. 1. Turn on the HeartStart. 2. Follow the HeartStart's voice instructions to access and apply the pads. 3. If instructed by the HeartStart, press the shock button to deliver a shock. The important thing to remember is that regardless of the HeartStart model you use, operation is similar. For additional information about using each of the HeartStart defibrillator models, visit www.medical.philips.com/HeartStart, click on the defibrillator model you want, then click on Demo. You can make the difference between life and death by having a HeartStart defibrillator and being prepared to use it. HeartStart defibrillators from Philips. Power to save a life.